So anogenital warts are caused by the human papillomavirus, and most typically it's types 6 and 11 that are the cause of about 90% of genital warts. So most anogenital warts are benign, and they cause fleshy skin-colored growths that are either hard or rough if it's in the genital area. If it's inside a genital, like inside the vagina, it can be soft and fleshy lumps rather than hard skin over it. Some of the lumps will be flat, others will be raised and pedunculated, and a lot of them can look almost like a cauliflower. The lumps aren't typically painful and they don't cause irritation usually, although occasionally if they're inside the urethra, it can cause pain when urinating and itching. Typically, the lumps will start growing about 3 weeks up to even 8 months after the contact, and they are spread usually by skin-to-skin contact during sex. In many cases, genital warts are asymptomatic in the sense that people can have an HPV infection without any genital lesions that are visible, and they can even resolve by themselves for up to anything up to about a year. People who become symptomatic will have these fleshy lumps or growths in the genital area, and if you ever see anything abnormal, you have a shower or when you're having sex or somebody comments, it's a good idea to get them checked out, because occasionally these lumps or genital warts can also contain more risky types of HPV, which could potentially lead to more serious implications or complications down the line. Obviously, when you have genital warts, they are easy to spread through sexual contact, so you want to try and avoid infecting other people. So obviously, if you have any symptom of an STI, including genital warts, it's best to get checked by your doctor so that they can make a diagnosis. It also is important to do, like I said, because you can protect sexual partners from getting genital warts themselves. So anytime that you think that you've got anything abnormal as a symptom, you should get that checked out. And we also advise to get regular STI screening, even if you don't have symptoms, just mainly because it's possible to have asymptomatic infections when there are no visible signs. And the more sexual partners you have, the bigger the risk becomes for passing this and another STI to a partner. So most genital warts are not serious in the sense that they can either be treated or will go by themselves, but occasionally you can get what we call oncogenic HPV. So these are high-risk HPV, typically strains 16 and 18, and they are implicated in kind of chronic infection with HPV, which potentially can lead to cancers. And we know from studies that HPV can cause cervical cancer, but also anal cancer and throat cancer. And in a lot of the cases, HPV that is high risk is invisible, so people might not necessarily know they have it. If you have a high-risk strain of HPV, obviously it's a more serious implication. So what we generally recommend and do is to try and prevent a serious outcome by having screening programs. Everybody is familiar with things like the cervical screening program, which is really in place to detect abnormal changes that is caused by high-risk HPV. And that means that by screening people, we can detect these changes early enough so that they are treatable. It is problematic in the case of, for instance, infection in the throat, because HPV infection in the throat doesn't often have many symptoms. And as mentioned, it can lead to cancer of the throat. So it's vital that if you have any abnormal symptoms in the throat that last and cannot be explained, something like metallic taste in the mouth, for instance, or ulceration that doesn't go away, pain in the throat, lumps in the neck, that you go and see in the first instance your dentist, who can have a check inside the cavity to see if there's any signs of HPV, and or see your doctor so that they can refer you to a specialist so that they can check for HPV. So first of all, it's important just to get a diagnosis. There's obviously other lumps that can look like warts in the genital area, might not be warts. So it's always important to get any skin lesions checked out in the first instance. Once a diagnosis has been made of genital warts, there's a few ways we can treat them. There's over-the-counter acid treatments that we can give, something like Watercon. And the acids basically work by eating away at the fleshy growth itself, and is applied for several weeks to try and eat away at the growth. It doesn't always treat the virus, and it can be difficult for people depending on where the genital warts are located. So it's not always an ideal treatment method, but nevertheless, it can be done at home. So obviously, sometimes that is easier to do. The most common treatment that I use, and the one I think is most effective, is cryotherapy. So cryotherapy is really treating a lesion with very, very cold liquid nitrogen, which then causes destruction of the actual lump. And we also try and get to the skin underneath in the hope that we can catch the virus when it's just underneath the skin. Cryotherapy is really effective at getting rid of warts, but you need repeated sessions usually, depending on the quantity or the amount of warts that are on the skin and also the size of them. But on average, I would say that we need at least 3 or 4 treatments on any given lesion before we see them go away. And some people, it takes a little bit longer, but generally we advise that they have weekly or maybe a 10-day break in between the treatments so that we can really freeze until the warts are away. You can also do laser treatment. So laser treatment is really effective if there are large areas of warts or if they're very inaccessible. And then there's also surgery, obviously, as a kind of a last resort, but we prefer to use all the other modalities beforehand. One of the only treatments that actually treats the virus is a immune modulating cream that we use called imiprimod, and that can be effective, although it requires quite a lot of patience, as it can take up to 16 weeks to see any results. And because it is an immune modulating cream, it can also cause problems with immune activation. So people can get systemic side effects such as fevers or itchy skin and sometimes lesions on the skin. So it's not for everybody, and we tend to use that as a fallback in people where cryotherapy on its own doesn't do the trick. So untreated genital warts are mainly a cosmetic issue and also a risk of infecting other partners. So we tend to see that people who have genital warts that aren't treated, there will be more and more warts that will grow, and sometimes they can spread to other areas in the genitals. So cosmetically, most people find that unacceptable. When you have genital warts, you're also more infectious to partners. So obviously, there's a benefit in treating them. It's unlikely that genital warts in themselves will become cancerous unless there's a high-risk strain in the wart as well. So obviously that is possible. So we do recommend that people don't leave warts and rather get them treated. In women, it's important, especially because warts can be passed on during birth. So we obviously want to avoid any vaginal births if there is HPV or genital warts in the vagina pre-delivery.